This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This is part 52 in a 58 video series of the entire book. Please review our introductory video in our channel for the background information. We're now covering the medical section, and the subtitle is CRTD, Cardiac Resynchronization Therapy. This involves the implantation of a device that looks like a pacemaker. It is technically a biventricular pacemaker with special programming to control the atrial and ventricular sections of the heart so that they beat in unison. When a heart phases in and out of atrial fibrillation, not enough blood flow reaches the ventricular section of the heart, and that inadequate blood flow can cause heart failure and prevent recovery. 3 electrodes go from the CRTD to measure your heart rhythm just like an EKG machine does in the doctor's office. It records and measures atrial fibrillation events, and the electrodes deliver electrical signals to resynchronize the heartbeat and stop the AFib. The CRTD device is a very complex computer-controlled unit that remains implanted under your shoulder, under a flap of skin, until the battery begins to lose strength. Then you need a new one installed. The device often includes a digital telemetry transceiver to communicate with a control computer at the doctor's office. It can also communicate with a bedside monitoring device to notify your doctor's office of any special events or error codes. My doctor's office uses the bedside unit to report EKG events every 3 months. When I was first discharged, they would check on me nightly, every night, and dial up the home office computer, whereby the doctor's pacemaker clinic could check out any problems that required my immediate attention. In my case, the cardiologist that I was assigned was one of the foremost electrophysiologists in the country. He determined the cause of my advanced heart failure was continuous AFib, and it was due to genetically defective heart nerves after the measurements were completed. The CRTD at the time was fairly new therapy. He instructed me that it had not been released to the public. However, the company that manufactures it had given him authorization to start implanting test cases. A technician operating a digital telemetry computer in the operating room started the unit to control my heartbeat after installation. And that was also co-joined with the operating procedure to burn away the heart nerve that was firing erratically. So whether I'm sleeping at night or bicycling 15 miles an hour for 30 miles, the CRTD will pace my demand. So my heart rate will go up as the heart needs more blood flow. When I was discharged, I was set at 140 beats per minute at a maximum, and I often would exercise to that point where the device would cut out and then my heart would flop out of control. For the average person, it would feel like you are dying, but I realized it was something that was programmed into the device. On the second device that was implanted years later, in 2011, I requested that the maximum be adjusted up to 150, so I rarely exceed that level of heart output. If your diagnosis is constant atrial fibrillation, then discuss with your doctor the potential of a cardiac resynchronization therapy device. It is a costly device. While the price may be high, I'm still alive 9.5 years later. Your doctor may have to present a case to your medical insurance company to justify installation. If you have to pay for it out of pocket, the cost may be negotiable, but do not accept a permanent diagnosis that you must live with constant atrial fibrillation, because your life will not last very long. Sooner or later, a blood clot and the heart will continue to degrade as it loses nutrient flow, oxygen flow. So this is a solution that has now been found to be quite successful. In December 2013, a research study certified that using a CRTD with heart failure patients and AFib reduced their mortality or death rate by 40%. That's a 40. This result was compared to heart rate slowing drugs used to treat AFib. Another study on patients with chronic atrial fibrillation, published in the journal Heart, confirmed that the CRT-D had a significant clinical benefit on all test subjects. The next study in Heart Rhythm magazine on September 8, 2011, proved that there is a great decrease in the mortality rate of 36,935 patients monitored when the CRT-D is capable of full biventricular pacing. So in my case, I also had the AV node ablations, that's atrial and ventricular nodes, burned away from my nerves. So a clinical study released at the American College of Cardiology on February 21st, 2012, studied the impact on patient mortality after ablation. The conclusion revealed a large decrease in mortality when used with a CRT device. I can testify to the result. I've never felt better, and I continue to get stronger. If the cardiology medical group that you are working with does not have an electrophysiologist, you will need to find the best one in your area who feels comfortable with CRT-D implementation, surgery, and installation. To give you an idea that this is not a common skill, I was sitting next to a federal district court judge on a flight to the West Coast a few years ago. His wife had brought him to some of the best heart disease clinics in the United States, the top clinics, the Mayo Clinic, DeBakey's Clinic for treatment of AFib, and none of them could treat him successfully to stabilize his atrial fibrillation. I gave him my doctor's name and phone number because for my doctor, this is a simple procedure that he's been doing for 10 years now. There are dozens of clinical studies and trials confirming a significant decrease in mortality for patients with heart failure using CRT therapy. This does not mean that your personal case requires a CRT. You need to review the options with your cardiologist. And keep in mind, he may not be comfortable with something that he does not do. So do not accept a diagnosis that you must live with AFib, or continuous AFib especially, when there is a solution on the market. My name is J. Randall Wilkerson. I'm the author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This book is available from Amazon in print and Kindle editions, from the Apple iTunes Store in the iBooks edition, on eBay in a print edition, and directly from the publisher, Wilkerson & Hughes, P.O. Box 777, Altoona, Florida 32702. Just enclose a check of $24 for the book with shipping. Thank you for listening.